I almost got peed on. I almost got pissed on. Urine all over me and my scrubs. I'm a nurse, by the way, so that's just part of the job. That's part of the job. I was dealing with a really confused and combative patient at around 6 p.m. That is sundown hour for everybody that's not familiar. Sundowning is when you have a patient that's on the older side and has a history of dementia. They get a little bit more confused when the sun goes down. They were being super aggressive, super combative, and were refusing every single medication. And they came in for a UTI. They needed their antibiotics. That's the most important medication. They needed their antibiotics. So I reached out to my resources, my charge nurse, my other fellow nurses with more experience, and I let them know about the situation. And they're like, you should reach out to the MD, let them know that you might need a medication, maybe even restraints if this behavior continues. I reach out to the MD and they're like, all right, I'm gonna give you a 1-to-1 sitter. What's that gonna do? That's not gonna, they're gonna sit there, but I still can't give them their antibiotics. For some reason, the MD does not want to do any measure that's going to be helpful in any way, which is why this whole story was just a long-winded thing for me to say. I feel like MDs in medical school, they should at least have like one nursing clinical, at least one, so they understand what we can do and what situations merit certain intervention. I totally get not wanting to do restraints, maybe not even doing certain medications. I totally understand that. But in this situation where our patient's denying everything, not letting us give their antibiotics, which they need, we need something that's going to work, not a 1-to-1 sitter. I feel like docs should work a nursing clinical. At least one to know what's up. At least one.